Alright, students, let's continue. So, actually, due to some issues, we are recording this lecture and posting it online. So, rather than going live because of some network issues. Okay. So, let's start with the topic of anxiolytics. Okay. Anxiolytics. So, these anxiolytics are the group of drugs. Basically, what? They are also hypnotic medications. So they decrease your anxiety. At the same time, they will also cause sedation. So what? They'll put you to the sleep. Okay. So anxiolytic drugs, when we need to understand about somebody called as a GABA. Now, what exactly is this GABA? My dear students, it is a type of inhibitory neurotransmitter to the central nervous system. Now, when I'm talking about inhibitory to the central nervous system, is there any other substance? One of the most commonly abused substance, that's your alcohol. So, alcohol is also a inhibitory to the central nervous system. Now, when we are talking about this inhibition and etc., so first and most important, what we need to learn? What we need to learn? We need to learn about a GABA. Okay. Now, when I'm talking about a GABAergic neuron, my dear students, we need to understand about a GABA receptor. So, GABA receptors are present where? Right here. Where exactly? Here. Where exactly they are? They are on the postsynaptic membrane. Now, when I'm talking about a GABA receptor, my dear students, it's an ion channel receptor. What is that? It's a type of ion channel receptor. It's a type of ion channel receptor. Now, once it is an ion channel receptor, it is a type of chloride ion channel receptor. Now, what happens? This neuron will release GABA. Okay. Once it releases GABA, GABA will act upon what? GABA will act upon the GABA receptor. Once it's act upon the GABA receptor, the channel will open. Once channel opens up, what is going to happen? That will allow the influx of chloride ions. If chloride ions comes inside, cell will become more negative. That is basically called as your hyperpolarization. Hyperpolarization. If cell undergoes hyperpolarization, it will require lots and lots of threshold to stimulate it. Okay, so that's how it is suppressing your central nervous system. So since it is central nervous system suppressing, my dear students, look here, this GABA, whatever जो भी release हुआ है, whatever it has released, it can be reuptaken back with the help of a transporter called as a GAT1. With the help of a transporter called as GAT1. And after that, most importantly, GABA inside the neuron, GABA can be broken down into the metabolites. GABA can be broken down into the metabolites with the help of an enzyme called as a GABA transaminase. GABA transaminase. Okay. So since we are talking about anxiolytics and hypnotics, first we will discuss those. After that, I will discuss all the drugs which are related to GABA. So basically, the funda is what? The funda is the basic story is what? GABA will come, activate the GABA receptor, allow the chloride ions to come. Now this GABA can be reuptaken with the help of GAT1. Okay, kahani. GABA जब वापस GABA once it come back to the neuron, it can be metabolized by enzyme GABA amino butyric acid transaminase, that is GABA transaminase. Okay. Now once I told you about this, my dear students, I want you people to understand simple logic. What is that simple logic? There are two important group of drugs which are working as a anxiolytics and hypnotics. They are your barbiturates. Okay. Along with barbiturates, my dear students, we have one more group of drugs that is called as benzodiazepines. Benzodiazepines. Okay. Now both of them benzodiazepines. Now both of them work upon which pathway? Work upon the GABA itself. How exactly they work? Let's learn. Okay. So let's learn about the mechanism of action. The mechanism of action of both of them is very simple. Very simple. What they will do? They bind with the GABA receptor. Bind with the GABA receptor. Okay. After they bind with the GABA receptor, what benzodiazepines do, my dear students, they will increase the frequency of opening. क्या करेगा? बार बार उसको ओपन कराएगा, बुलाएगा, किसको बुलवाएगा? That is your basically GABA receptor. They increase the frequency of opening. They increase the frequency of opening. Done. Okay. Now, when I'm talking about barbiturates, they increase the duration of opening. What is that? for long duration, they increase the duration of hope. They increase the duration of hope. So this is the story of your what? This is the story of your mechanism of action. Apart from mechanism of action, we need to understand these barbiturates are more addictive. Barbiturates are what? More addictive. If they're more addictive, now look here, what about benzodiazepines? Benzodiazepines compared to barbiturates, they're less addictive. They're less addictive. Okay. Now, benzodiazepines are less addictive. Okay, barbiturates are more addictive. This is the most important factor to be known and the mechanism of action. Now, apart from that, my dear students, barbiturates are the derivatives of barbituric acid. Barbituric acid. So, if they are a derivative of barbituric acid, means all of these drugs are acidic in nature. All of these drugs are क्या nature होते हैं? Acidic nature में होते हैं. इसके अंदर क्या क्या है? So we have phenobarbital, okay. Phenobarbital के अलावा कोई और है क्या? Yes, we have any other? Yes, we do have secobarbital. Apart from secobarbital, from the anesthesiology, if you can recall, we have an induction agent. The name of the induction agent is called as thiopental. So these are the drugs which comes under what? Which comes under barbiturates. Okay, thiopental का use क्या है? Thiopental is where exactly it is used. In anesthesia, it is used as a induction agent. It is used as a induction agent. Why it is used as an induction agent? The reason is very simple. My dear students, thiopental gets distributed very fastly, very fast distributed drug. Since it is fast distributed drug, is the onset of action. From how long it will show the action means from the time I inject the drug till the time it show the action. So that would be called as onset. The onset of action is usually 8 seconds. Onset क्या होता है? Onset of action is usually 8 seconds. That is why we use them in anesthesia as a induction agent. Okay, very good. Apart from that, let's come back to your what is that? Benzodiazepine. So benzodiazepines, the drugs include your diazepam. तो now शुरू हो जाओ फिर diazepam के बाद शुरू हो जाओ फिर zapam lorazepam, very nice. Any other palm? Yes, clonazepam. Okay, any other palm? But one important, it doesn't end with palm, but still it is a benzodiazepine. That's called as midazolam. This is one of the most important aspects to be remembered. So these are the drugs when we are talking about barbiturates and your benzodiazepines. यहाँ तक खत्म हो गया. Let's consider the uses of all of these drugs. Okay, where and all we use which drugs when exactly? Let's learn. So these are used in insomnia. Write down insomnia. The drugs can be used in insomnia. So since barbiturates are more addictive, we go for a less addictive ones. Insomnia में the drug of choice always your BZD. BZD मतलब what? Benzodiazepines. Very good. Next, remember here only, don't go for Z drugs. Most importantly, they are your what? Insomnia के लिए drug of choice still what? That is your benzodiazepines only. Okay. Further story is very easy. These drugs can be used in seizures. Seizures. So when I'm talking about seizure. When I'm talking about seizure, my dear students, you need to understand if there is an active seizure. If there is an active seizure, means in front of your eyes, patient is having an active seizure. That is the time you can go for what? That is called as lorazepam. That's called as lorazepam. Apart from that, you'll understand these uses, especially seizure-related use. कब समझ आएगा? Antiepileptics में थोड़ा time सबर. Okay. Apart from that, where else we can use? भाई साहब तुम लोग तो भूल ही गए. क्या भूल गए? What you forgot? You forgot the heading itself. What is that? Anxiety. Very good. They can be used in a anxiety state. They can be used in the treatment of anxiety itself. Okay. So these are the uses of your what? Benzodiazepines. Got it. Now, by mistake, if there is an overdose, if there is an overdose of either of them, overdose of what? There can be possible barbiturates, overdose of barbiturate can happen, barbiturate can happen, or there can be overdose of what else? Of course, benzodiazepines can happen. So either way, these are the potential questions. Okay, these are the strongly recommended questions. I would tell you people to please remember everything about these things and understand everything about this. So the antidote for benzodiazepines, the antidote for benzodiazepines, that is called as flumazenil. What is that? Flumazenil. Okay, okay. Flumazenil is what? Antidote for the benzodiazepine. Basically, it is having an antagonist property, antagonist property, antagonist property to whom? Antagonist means what? No intrinsic activity. Antagonist property to whom? To the BZD receptor, benzodiazepine receptor, benzodiazepine receptors. That's why it is considered to be an antidote. But problem with barbiturates, barbiturates are not exactly treated in the same fashion. Why? Because barbiturates are the acidic drugs and we don't have a specific antidote for them. So flumazenil won't be useful here in the barbiturates because of one reason. The benzodiazepine receptor itself is having a multiple subunits, etc., etc. So that is the reason which flumazenil will not be helpful here. So why? What exactly we need to do with barbiturates? The barbiturate story बहुत simple है भाई, बहुत simple my dear friends. That's very easy to understand. The first alkaline diuresis, alkaline diuresis. This first alkaline diuresis will be definitely a question for you people in your exam. Do not miss this because from the pharmacokinetics dynamics chapter, especially pharmacokinetics, I made you understand how exactly first alkaline diuresis works, and please do know about the first alkaline diuresis. Okay, so once we understood about this, since we are into the GABA today, let's discuss about GABA related drugs even. Okay, so I want to discuss one more important. I have GAT1, right? I have GAT1. GAT1 था ना हमारे पास. GAT1 क्या कर रहा था? Transporter. GAT1 what it was doing? Transporter. What it was doing? It was doing the reuptake. So if I inhibit the GAT1, if I inhibit the GAT1, so what will happen? Decrease the reuptake. Decrease the reuptake. Reuptake of what? Reuptake of new noradrenaline or GABA. Of course, decrease the reuptake of GABA. If there is a decreased reuptake of GABA, that means what? That will increase the activity, that will increase the GABAergic activity, that will increase the GABA activity, that will increase the GABA activity. So we have GABA. Okay. The another possibility is what? GABA transaminase. Yeah, GABA transaminase. If I inhibit this GABA transaminase, imagine that will also increase the GABA quantity. So both of them can increase the GABA quantity. So GAT1 inhibitor, where do we use this? Both of these drugs are used in the treatment of epilepsy usually. Epilepsy में use कर सकते हैं. But most importantly, what you people should be knowing? The names of the drugs, because examiner might point at you which of the following drug is a GAT1 inhibitor. They might ask you a potential question like this. So my dear student, GAT1 inhibitor that is called as Tigabine. The name of the drug is called as Tigabine. The name of the drug is called as Tigabine. क्या बोलते हैं उसको? Tigabine. Okay. All those. There is one. Which is that one more drug? Here in the GABA transaminase inhibitor. What is that drug? GABA transaminase inhibitor. The name of the drug is very simple. इसको repeat करो. Vigabatrin. Repeat it. Vigabatrin. Repeat again. Vigabatrin. Repeat again. Vigabatrin. And the last and most important group of drugs which works with GABA system, my dear students, look here, they're very simple for you to understand. There are some group of drugs which increase the availability of the GABA, okay, and also they increase the release of GABA. They also increase the release of the GABA. How exactly? We don't know it. Okay, we don't know it, but they do this. Which are those two drugs? There are two drugs. One of them is called as pregabalin. क्या बोलते हैं उसको? Pregabalin. प्रेगाबैलिन. ओके, मतलब क्या कर रहा है? बेसिकली गाबा को अवेलेबिलिटी ज्यादा करवा रहा है या गाबा रिलीज करना कराने को बढ़ा रहा है. तो व्हाट इज एग्जैक्टली दे आर डूइंग? दे आर ईदर इंक्रीजिंग द अवेलेबिलिटी ऑफ गाबा or they are increasing the release of the GABA. That is the pregabalin. And one more drug, the name of the drug is called as gabapentin. Gabapentin. Okay. Now both gabapentin and pregabalin, they have one nice feature. What is that feature? तुम लोग feature बोलते कहीं और चले जाते हो. भाई साहब वो सा वाले feature नहीं कर रहे हो. उनका एक characteristic है, उनका property है. Okay. What is that property? The property is that they are neuroprotective. Or we can also call it as neurotonic in nature. They protect your neurons. Since they are neurotonic in nature, they are used where? They are used epilepsy में ज़्यादा कहाँ पे use करते हैं इसको? They are used in neuropathies. Neuropathies. कौन सी neuropathies? Classically asked by diabetes mellitus. This is the story of your गाबार्जिक ड्रग्स. गाबा में जितने भी ड्रग्स हैं. तो आप लोगों को एक मोस्ट इंपॉर्टेंट कंफ्यूजन आता है, दैट इज कॉल्ड एज जी ड्रग्स. जी ड्रग्स. जी ड्रग्स आर द लेटेस्ट ones. These are the drugs. What exactly they are doing? These are the drugs which can be used for insomnia. Can be used for insomnia. Can be used for insomnia. Used for insomnia. But what is the most important? They are not the drug of choice. They are not the drug of choice for insomnia. So what is the speciality of Z drug? The speciality of Z drug is that these are the drug. They don't alter. मतलब क्या करते क्या नहीं करता है ये sleep cycle को change नहीं कराता है. Means what? They do not alter the sleep cycle. They do not alter. They do not alter the sleep cycle. They do not alter the sleep cycle. Sleep cycle. So that is the reason we have Z drugs as a separate category of the most important among them, that is called as zolpidem. Zolpidem. That is called as zolpidem. So this is the story of all the GABA.